Welcome to the Orion Health demonstration of our International Patient Summary, or IPS. Over the past decade, we have worked to iteratively refine our implementation of the FIRE framework. Today, we're excited to show how that work comes together in the generation of an IPS. This has been a journey of development and collaboration, including one of our key partners, Sparked. Through Sparked, we connected directly with clinical and technical experts, tested real-life scenarios. This helped inform and shape the way we've approached implementing the IPS. Through the Accelerator program, we gained valuable insights and refined how we deliver IPS interoperability. This past March, we participated in the HL7 Australia Connectathon, where we integrated with the National Fire Server and third-party practice management systems, providing valuable insight and validation of our approach. It highlighted new testing methods and gave us the opportunity to reconsider our assumptions based on new perspectives. So let's dive into the demo. We'll begin with the technical overview. Now, our IPS is structured in a JSON format and based on the IPS universal profile. We have implemented the 3 required sections: allergy intolerance, condition, and medication history, and 1 additional recommended section, diagnostic report. Here you can see that I've set up Postman to point at our IPS REST endpoint, and this is pointing to one of our demo systems. Applications would invoke this with a patient identifier to request an IPS document for that patient. As you can see, these are the parameters. And when I click send, what I've done is I've invoked the request and it's been received by our IPS generator. In the background, it's coordinating FIRE requests for allergy intolerance, condition, and for medication history, it uses medication request, administration, dispense, and statement. And for our last section, diagnostic report. Now the response is quite large for this patient, but if we scroll here, we can see that it's a JSON document conforming to the IPS specifications. Now, requesting systems may choose to use the discrete data elements in each section. For example, here in the allergies, if we just quickly search, you can see discrete data elements, or they may choose to use our narrative sections, which are formatted as HTML snippets. Now, of course, this JSON document is the behind-the-scenes application level exchange and interoperability. We still need a way to present this information to clinicians and patients alike. So now we move to the Orion Health Clinical Portal. Here we see Caitlin Connor, who is a clinician, reviewing a patient record for Gerard. She can see his clinical data in the standard summary view: allergies, conditions, medications, diagnostic reports. However, as soon as she needs an IPS, she would go to the tree on the left and select it. When she clicks on this IPS document link, the service endpoint, which we saw earlier in Postman, is called, and the patient IPS is generated on demand using up-to-the-minute patient data. Now, in this demo, we've used the individual narrative HTML sections and combined them into an HTML page. This gives us flexibility in formatting and display, for example, branding. Systems using our IPS on-demand endpoint may choose to use the native displays within our application, leveraging those discrete JSON data elements I demonstrated earlier. Now, this presentation of IPS within our solution is not intended to be limited to only Orion internally generated IPS, but also externally generated IPS that the solution may have access to. In this manner, solutions can get a running start to interoperability, which in turn improves accessibility to key data for clinicians. We believe that this technical framework and visual representation of our IPS lays the foundation for future care that is accessible, secure, cross-border care, allowing health data to follow the patient wherever they go. At Orion Health, we're excited to help build that future, a future where connected care is the standard, not the exception. Thank you.